From Montana's news leader, this is the MTN 9 o'clock news.
Good evening and thanks for joining us on this Tuesday. I'm Russ Riesinger. There are now 13 deaths at a Billings long-term care facility, the deadliest COVID-19 outbreak in Montana. Just yesterday, employees with Kelch Communities, the company that owns Canyon Creek, traveled to Billings from Washington State for what they called a day focused on residents and employees. County health officials say the latest victim, a woman in her 90s, passed away at Canyon Creek yesterday. Again, this is the 13th death in the last 15 days tied to the outbreak at that facility. Yellowstone County Health Officer John Felton says he's running out of words and says, quote, "For those who still doubt the reality of COVID-19 and its impact on all of us, I encourage you to wear your mask and wash your hands." Well, tonight, for the first time, we're hearing from the leaders of Canyon Creek Memory Care Facility. That outbreak there happened after the facility refused voluntary testing for the state of Montana. As our Andrea Lutz reports, officials with Canyon Creek say those voluntary tests would only have provided a snapshot of results for a small moment in time.
Traveling to Billings from Washington State for the first time since COVID-19 appeared in their facility, leaders of Kelch Communities say their primary focus is on residents and staff.
It's been a busy time and they come first. We have to make sure that we're taking care of them.
Chief Operating Officer Eva Arendt says that's why officials haven't addressed questions publicly yet regarding why voluntary testing was initially refused.
So we opted out, as did, I believe, 100 other communities in the state of Montana.
Kelch, a family-owned business out of Olympia, Washington, operates over 30 facilities in 8 states. During a Zoom call the day after leaders, including the company's CEO, left Billings, they say they stand by their decision to opt out, but did promptly take measures to ensure there was no cross-contamination when the virus was initially discovered.
All it would do is give us a picture of those results for that moment in time. Residents could be exposed or staff could be exposed the very next day and test positive later in the week.
But Arendt says they want the public to know administering a COVID test to a dementia patient is complex.
The deep nasal swab test is invasive, and to a person who does not understand what is happening, it can be very scary for them.
The outbreak started with a resident who tested positive at the hospital on June 30th. The state offered its free testing in mid-June.
We have put in place policies and procedures that we feel have protected our residents well. I mean, it is June 30th when Canyon Creek had their unfortunate outbreak. And though we've been in the throes of a pandemic since late February.
Currently, 43 of its residents have tested positive with COVID-19. 2 are currently negative. Reporting in Billings, Andrea Lutz, MTN News.
All right, thank you, Andrea. And we do want to point out that there is currently no federal testing requirements and the rules apply differently in every state. Those with Canyon Creek say more testing is happening now, with one round already finished and another round of COVID testing underway. Tonight we hear from the daughter of a Canyon Creek patient who recovered from COVID-19 about her experience with the facility's staff. This is 91-year-old Janet Jordan, who's been living in Canyon Creek since April of 2019. Janet's daughter Karen said her mother contracted COVID-19 about 3 weeks ago after coming back to Canyon Creek following hip surgery. Karen said Canyon Creek staff kept her well informed about the situation in the facility, receiving around 10 emails from staff after the first positive case. Staff provided many opportunities for the family to call and even video chat with their mother while visitation was restricted.
I can't stress enough how caring the staff has been, how well the staff has taken care of her, and how loving and compassionate they've been. And that is very humbling to us as a family, that there is a place where our mom can be, where we feel that she's well cared for and loved. That's priceless to us.
Well, Karen says her mother didn't experience many symptoms other than feeling more run down than usual. She didn't need to be put on oxygen or a ventilator while fighting COVID-19. Well, yesterday's death marks the 18th here in Yellowstone County, the 40th across Montana. In addition to the new death, the state reported 97 new cases today. Gallatin County added the most new cases with 18, while Yellowstone County recorded another 14. Montana now has more than 1,100 active cases with 49 patients hospitalized. Yesterday, Wyoming reported the largest single-day increase in COVID-19 cases since the pandemic began in March, leading to another death this afternoon, bringing the total now to 25 in the state. Wyoming has now surpassed the 1,800 mark for confirmed cases, and of those, more than 1,300 have now recovered. Riverstone Health is temporarily closing its immunization clinic to try and keep up with contact tracing for the influx of new cases. The staff will be reassigned for the time being to help the more than 130 cases that are awaiting investigation. Trained staff will be interviewing each person who tested positive in hopes of determining how they might have contracted the virus and keep it from spreading further in the community. The immunization clinic will resume normal operations on Monday, July 27th. It is arguably one of the biggest questions on the minds of parents. Will in-person learning actually take place this year? Well, tonight, Congress is considering sending school districts over $100 billion to safely reopen. But is it enough, and where will that money go? Our Joe St. George is in Washington with more.
We don't actually know when recess will actually happen again and school playgrounds will be utilized, but we do know that Republicans want to reopen schools, and they are prepared to spend billions to make it happen.
This country wants its kids back in the classroom this fall, learning, exploring, making friends.
That was Republican leader Mitch McConnell today. His GOP plan sent $105 billion to school districts to reopen. Because there are 13,000 plus school districts in the country, that breaks down to around $8 million per district, although every district will get a different amount. Bigger districts, more money. Districts that stay closed, less. The money, we are told, would be used for sanitation and reconfiguring schools for safe learning. Is it enough money, though? Well, it's not enough money to build more classrooms so students can socially distance, but it will help districts buy PPE, including masks for teachers. We should be clear, though, this doesn't mean your child's school will reopen. That decision will still be handled locally and in some states by the governor. And in some locations, teachers are even beginning to speak up. In Florida, the state's largest teachers union has sued because they don't want to go back to in-person learning this fall. In Washington, I'm Joe St. George.
Well, in just a few short weeks, Billings students and teachers will head back to school amid the COVID-19 pandemic. Billings teachers are feeling some apprehension as the start of this school year holds a lot of unknowns. According to the Billings Teachers Union president, teachers are ready to prep their curriculums but aren't sure whether they'll be teaching online classes. The superintendent's back-to-school plan makes parents decide between strictly online or in-person schooling for the student.
I think overall our teachers are worried one, about their students and making sure that they're safe and healthy. They're worried about their education. You don't get into teaching unless you worry about your students. And so that's one of theirs. And then they're worried about their families themselves, making sure that they're able to do what they're passionate about, but making sure that their families are safe as well. So I think that's there. I think there's also just the overwhelming, I think we all have this worry of the unknown. We don't know what next month is going to look like. And we've been in this kind of roller coaster of that since March. And so I think that's just everybody is a little worried about the what ifs.
Shilriff said the union has a survey out to its members now to gauge their feelings about heading back to school. She said they expect the results tomorrow. As Billings schools prepare to open in a couple of weeks, one of the big questions is how will kids do wearing masks? Well, the concern is that it will be tough to keep kids masked up, especially young kids who may not understand the importance of facial coverings. At the Boys and Girls Clubs in Billings, the experience of masks and kids has been positive so far with very few problems.
I was worried about it, I got to be honest, and I have been just pleased. Like I said, other than a few minor issues, and you know, we had a member that we have some asthma concerns, you know, some of that sort of stuff, which you're going to have. The kids have really blown what I was expecting away. I mean, they've really done a nice job. We've been real intentional about how we plan our day, give them a chance to get outside, take their masks off every hour or so. So we've been intentional trying some different things, but the kids have just kind of taken it in stride. It's actually been probably harder for me to remember to grab it off my desk and take it with me everywhere I go.
Well, the Boys and Girls Club started to require masks last week when Governor Bullock issued his directive. Dennis said a letter was sent to parents to explain the new policy, and so far the switch to masks has been a big thumbs up, he says. Well, 2 people are dead following 2 fatal crashes in Yellowstone County that happened less than an hour apart. The first accident on I-94 East near Lockwood happened just before 9 o'clock last night. A white Dodge pickup in the left lane was passing a black Chevy pickup in the right lane. The driver of the Dodge moved over too soon and clipped the Chevy. The Dodge rolled multiple times and the 48-year-old male driver was ejected and died on the scene. He was not wearing a seatbelt. The driver of the Chevy was not injured in that crash. The second as a hit and run. It happened about 50 minutes later on 72nd Street West and Laurel Airport Road. Two people on a motorcycle were rear-ended by a sedan, and one of the motorcycle riders died on the scene. The Montana Highway Patrol says the sedan fled, and at this time no suspects are in custody. The description of the suspect vehicle is not being released yet. There's no word on the condition of the second rider. Yesterday, as part of MTN's coverage of the 2020 vote, we fact-checked a pair of TV campaign ads attacking Democratic U.S. Senate candidate and Governor Steve Bullock. Well, tonight, Chief Political Reporter Mike Dennison does the same for a Democratic ad that's attacking Bullock's opponent, Republican incumbent Senator Steve Daines. The underlying issue in all of these ads is the same: health care.
The ad going after Daines is from Majority Forward, a national group affiliated with the Democratic Super PAC. It starts by saying drug and insurance companies are profiting from the coronavirus pandemic, and then says this about Senator Daines.
Daines voted to give them billions in tax breaks as they jacked up prescription prices.
The ad is referring to Daines' vote in December 2017 for the Republican tax cut package, probably the signature achievement of the Trump presidency and his GOP allies in Congress. Large corporate tax cuts in the bill certainly benefited drug and insurance companies, but it benefited all corporations doing business in the U.S., large and small, and lowered income tax rates for individuals too. And Daines pushed for amendments to the bill to increase its benefit for smaller businesses. Daines' office also notes that in 2019, he was one of several Republican senators supporting a bill opposed by the drug industry that's meant to reduce drug prices through rebates and other pricing practices. A year later, however, that bill is still pending in the Republican-controlled Senate. Majority Forward's ad then makes this statement about Daines.
Daines even voted to let insurance companies deny coverage for people with pre-existing conditions like diabetes, asthma, and cancer.
They're talking about Daines' several votes in Congress to repeal the 2010 Affordable Care Act, the law that stopped insurers from denying coverage or applying high premiums to people with pre-existing medical conditions. Daines still opposes the ACA, but says he supports protections for people with pre-existing conditions that are contained in a separate Republican bill that's before the Senate. Democratic critics, however, say that bill has loopholes that could allow discriminatory pricing by health insurers. We should also mention that Majority Forward is a dark money group. It doesn't reveal its financial donors. And Montana's disclosure laws do not apply because Majority Forward is spending money on a race for federal rather than state office. Reporting from Helena, I'm Mike Dennison, MTN News.
Still to come on the MTN 9 o'clock news, another day of protests, another day of federal officials stepping up their actions to stop those demonstrations. We're going to have the latest from Portland coming up, but first, the heat is on. Bob is next with that full forecast.